Hey everybody, this is Jenny McAteer with Resolve Physical Therapy here in Bend, Oregon, and we are doing another Wednesday Wisdom episode, and this time it is with Dr. Amanda Westfall. Go ahead and introduce yourself.
I'm Amanda Westfall, and I'm over at Central Oregon Foot and Ankle. We treat anyone from kids with ingrown toenails to older diabetics with wounds. We work a lot with runners and do lots of sports medicine, but anything foot and ankle.
Perfect. So today we're going to kind of talk about plantar fasciitis as our topic, because that's a hot topic for us, at least in the physical therapy clinic, and kind of a difficult diagnosis. Most people struggle with that one for a long time when they have it. So first we're going to kind of just get a quick overview on the anatomy of the foot. So I don't think people realize how much goes into the foot. So can you give us an idea of like how many bones, muscles, ligaments, that kind of fun stuff?
Yes.
Fun facts.
So there are 28 bones in your foot. We have two little bones that sit under our big toe called the sesamoids, and some anatomy books say there's only 26 bones, but there are 28. We have 33 joints and over 100 tendons, ligaments, and muscles down there.
See, I don't think people realize 100. That is a lot.
Yes, there's a lot going on.
So that is why we always say feet are so important. And we actually do some little strengthening routines for the feet all the time that people sometimes laugh at us for. But we have to take care of our feet. So with plantar fasciitis, I also think it's a diagnosis that has grown into what people think it actually is. So can you give us kind of a definition of what that means?
So your plantar fascia is a big, thick ligament at the bottom of your foot. It starts down underneath your heel bone and then hooks all the way down into the ball of your foot. And you can think of it as a thick rubber band. So every time you walk, your arch starts to kind of flatten out and pull on that ligament. When you get plantar fasciitis, it's inflammation of that ligament, thickening, and the ligament actually appears thicker with little tiny tears in it. And it's kind of a chronic problem. You usually don't just wake up with it one day. It just slowly builds up in pain and inflammation.
And are there usually bone spurs involved with it? Another question we get a lot.
You know, not always. You could have a bone spur on both heels, but one may never hurt. The ligament, as it pulls over time on that bone, can form a bone spur, but not everybody has one. And it's more of like an old style thinking that you need the bone spur removed. We can usually get the inflammation and pain out of the ligament without surgery.
Okay, we always love to hear that, of course. And then what if any, misconceptions do you often hear about plantar fasciitis when they come see you?
Well, a lot of people think that if they buy a special shoe or a special arch support that it'll just fix the problem. Because it's usually been going on for a long time and it's chronic, then it can be harder to get rid of. So there's no quick fix or easy, simple one thing that you can buy to fix it.
And we love to hear that because we have to tell our patients that all the time. And does it seem like it runs in a particular age group, gender,
we
activity
often
level?
See it in the like 40 to 70 year age group because it can be overuse. People that stand on hard floors or work in retail can have this problem. If we have worn out shoes, that can have a problem, or if you're starting a new activity. So actually going into quarantine, a lot more people were walking and hiking and had a lot of heel problems because it was a new activity or they increased the volume really quickly.
Too quickly. Okay. And then some people think it is just arch pain and some people think it is only heel pain. What do you say?
And so that ligament goes the whole bottom of your foot and there's 3 bands of it, so it can be pain at any
kind of
spot.
Anywhere, right?
And most commonly heel pain is plantar fasciitis, but there are other things that can go wrong down there. You can get a bursa, there's nerves that can get impinged, so there's other things that can happen. So if you're treating traditional plantar fasciitis isn't working, sometimes we have to think outside the box that there may be something else going on.
Something else happening, okay. And then, of course, what everybody likes to know, what are the best ways to treat it, in your opinion?
So we try and do an approach where we look at pain relief, so things like icing, rolling on a ball, A topical pain reliever like an arnica or menthol-based pain reliever can be helpful. We like the support in there, so that ligament, so it doesn't stretch every time you walk. Putting a little arch support in there can be helpful. Again, it's not going to fix it, but that can help with the pain relief. Changing shoes can be helpful. Getting a little more support or a new pair of shoes that's not worn out can be helpful.
Okay.
And then stretching and strengthening are also a big component of it. So tight calves and hamstrings contribute to it, and the little foot muscles like you were talking about before, if they're not working well, then that ligament has to overwork. So if we get those stronger, then that can be helpful.
Okay, so some good stretching and strengthening, which of course we are happy to help with there. Some good shoes, and then what about a night splint?
So a night splint can be helpful. It stretches out, so if this is our foot and our calf, stretches out you while you're sleeping, but not everybody is able to sleep in that.
Yeah.
So there's a splint or a sock that can be helpful. Okay. You can do a lot of those stretches on your own. We just usually don't hold them as long. So it just would be something that maybe if you could wear while you're watching TV or reading or something like that versus wearing it all night long, it can help, but it doesn't fix it completely.
Yeah, I would say most people do not like to wear those
right.
much longer than like an hour or two. So while they're watching TV or something is a great idea, because the idea is just to get a prolonged stretch versus just doing a regular calf stretch.
Because you just can't hold it as long.
Yes. With that. And then I think that covers basically what we go over with patients when they're here at Resolve for physical therapy is we will, definitely look at your shoes to see if they're very worn out. We'll even do a video gait analysis typically of somebody on the treadmill to see if they are excessively pronating or just need a bit more support. Definitely look into some orthotics, like she said, to take some pressure off of there. And then I like that she mentioned even tight hamstrings can cause it, because a lot of times when people see a physical therapist with plantar fasciitis, that provider I feel like focuses only on the foot itself, the arch itself. So we always like to go above that joint and kind of see what's wrong there. Like if it is a hamstring tightness or even a hamstring weakness or glute weakness, something along those lines. We'll try night splints with people if they can handle it. And then we do a lot of manual therapy for the myofascial restrictions.
And that's going to help that pain component. And often one leg will be either shorter than the other, whether it's just someone was born that way or they had an accident, or it's functioning that way. And so that's when physical therapy has been helpful for our patients, is looking at the hips to see if they're out of balance, any kind of muscle weakness.
Kind of stabilize that.
Right, because if one leg is always hitting more than the other, then that can affect it as well. So that's been really helpful, because we don't always look at their gait, but we look at it in a different way because we just have different training than you. So often if we say, oh, I think it's coming from up further in your hip, and we're the foot doctor, then people think, well, I don't know about that. So it's helpful to have them go to physical therapy and kind of reinforce that that could be the problem, and strengthening or stretching or manual therapy could be helpful.
Helpful with that as well. Okay, so that's kind of what we go with for the lovely plantar fasciitis. So one of the more difficult diagnoses that come out there, like she said, it's usually chronic, but we can help you. So call us, ask us questions. We'll get you set up with the right shoes, right stretches, right strengthening, all the above. So thank you so much.
Thanks for having me.
You're welcome. All right, until next time.